My name is Pamela Frank. I am Director of International Medicine and Business Development at Children's Hospital Boston. We did a panel discussion on inbound medical travel, otherwise known as inbound medical tourism, and I teamed up with my colleague from Johns Hopkins, the managing director there, and my main talk focus was really an overview of the inbound travelers market, primarily from the perspective of a U.S. academic medical center. We have, in my opinion, and most industry data would support this, probably the largest sector of the medical tourism market, which we affectionately refer to as medical travel for the reason that most of our patients are coming for very complex illnesses, and to associate their core issues with a word that might imply leisure is a bit insensitive. So we really spoke a lot about medical travel as from the perspective of U.S. Academic Medical Center, both past, present, and future, and then as well talked about how hospitals might go about partnering with us. It's been a long road for many of us. We've been in the industry for well over 15 years now, the inbound travel. Most international patient programs at U.S. academic medical centers, I can tell you Children's has probably been seeing international patients for over 100 years. We formally established our program 12 years ago, and since then we saw a very large dip after 9/11 due to the issues around visas for our core market, which at the time was the Middle East. And then we've seen a kind of steady uptake up through 2006, which is the last year of our verifiable data. Since then, we're getting mixed messages. Many people believe the market is flattening out due to increased competition from abroad and also added price sensitivity from our clients. And many people, though, are seeing that the actual market is growing. Children's Hospital Boston, for example, has seen a 13% increase on average every year for the last 5 years, resulting in a 50% increase since 2005. I've been twice now. I was here for your first one, and this is my second Medical Tourism Congress. I have seen a huge improvement, especially in the quality of speakers, but also I've seen some great networking opportunities here. I know when the Medical Tourism Congress first got started, there was some competition for the industry from Spain and the UK, and it seems as though this has really become kind of the premier medical tourism association of the world. I mean, the kind of participants that have come out from ministries of health from many, many countries are the kind of give us the networking opportunities that really we've seen over in Dubai at the major Dubai Healthcare City Congress. So it's really risen to the top quite quickly. Yes, I think the Medical Tourism Association has absolutely been first to the market. Because they are based out of the United States, a lot of countries are looking to them as a source of principal information. We, as U.S. academic medical centers, appreciate the opportunity that they did to bring in a new constituents for their core business. In many ways, we're perceived as the competition. We're looking for inbound travelers, not outbound travelers. And historically, our medical facilities have been somewhat reluctant to, or skeptical about the kind of numbers we've been seeing thrown around in the industry. And so we really appreciate the fact that both Renee and Jonathan opened this Congress to us and encouraged us to come and invited us to speak. I liked the opportunity. I thought it was, the setting was very well organized. I enjoyed going through the booths. I thought there was a good selection of exhibitors, but I really enjoyed as well just the opportunity to network. Yes, so our medical travel goals for the upcoming years are really to expand our international program. So we have for many years been receiving patients and providing core services to those patients. We have over 1,000 patients from all over the world every year, but our next goal is to really set up some strategy around governance. So we've hired new staff and we've decentralized operations and have actually dedicated myself now to full-time business development. I think that one question I often get is about healthcare reform and how that's going to impact us in the marketplace. And I would say that Massachusetts, where Boston Children's Hospital resides, is probably about 5 years out on the forefront in this area. We are the only state right now to have universal health care coverage, and quite honestly, what we're seeing, and again, I'm not a domestic health policy expert or a health economist, but some of the trends that we're seeing from healthcare reform are that costs are actually around procedures going down, and we just lowered our fee schedule for the first time since in recent history for I don't know how long, but certainly for more than 30 years. And we are also seeing that I think more greater transparency. And so interestingly enough, our hospital just identified by working collaboratively with insurance companies $80 million in costs that we could cut